Hello, everyone. Welcome to the Dr. Sophia ObGyn Podcast. I'm an ObGyn practicing for over 15 years in my native New York City, and I love to help women learn about their bodies, empower them, and embrace themselves. On this podcast, we talk openly and with heart about all things affecting women, from pregnancy, menopause, periods, sexual health, fertility, and so much more. Disclaimer: this is general medical information based on my professional opinion and experience. For specific medical advice, please refer to your physician. Hello, everyone, and welcome to the Dr. Sophia ObGyn Podcast. I am so excited to announce our guest. We have a guest speaker for today's episode, and she happens to be one of my closest friends, Dr. Sandy Dorcelus. So, the reason why we're so excited to have Dr. Dorcelus with us is because she is a specialist in family planning, and we felt the need to have the conversation surrounding women's rights, women's right to choice, women's reproductive rights, and abortion, especially in this climate of a presidential campaign and our VP, Kamala Harris, as our presidential nominee. So whoop, 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 we're so excited. And so I'd like to give a warm welcome to my friend, Sandy Dorcelus. And as always, we have with us our favorite co-host,
I'm a doctor.
You're a doctor now? My good friend, Touseef Mirza. Welcome, Sandy.
Wow. Thank you, Sophia. Thank you for that wonderful welcome. Nice to meet you, Touseef. I'm so grateful for you ladies for having me on your show. This is such an important topic, and I can't wait to dig right in. So welcome. Thank you, everyone.
Thank you so much,
Thank
Sandy.
you for being here.
Yes, we're super excited to have this conversation. Me and Sophia have been talking about doing this topic, this such important topic, and we felt like right now is such a perfect time to have this conversation. If you're listening at the podcast, like later on, this was actually taped at the end of August 2024. So at this point, Kamala Harris basically came in the forefront since 3 weeks ago as a presidential nominee. So obviously we're super psyched about it. And we know she's going to become the next president. So we're just really excited to really talk about all of these aspects from a hopeful lens as well, and seeing how we can transform the future while also recognizes how we got here. So I know that Sophia and Sandy, both of you know each other really well. So I'd love to hear how both of you know each other.
Well, Sandy is one of my road dogs. Sandy and I met back in college, and we've been bosom buddies ever since. And what's really interesting about our relationship, our friendship, has been the fact that we're always kind of piggybacking off of each other throughout our careers and what we've done over the years. So it first started out, first of all, we were both science majors in college, and we both knew that we wanted to go to medical school, but we took a different kind of journey in getting there. And I remember, I had Tyler, so my first son, just at the end of college. I remember you were working at Sloan, and I needed a job. And so I applied to a position at Sloan. But then afterwards, I left and decided to become a teacher because I had Tyler and was like, okay, not that I don't want to go to medical school, but, I want to do something, to be more involved in my child's life, et cetera, and wasn't sure if I was really ready to make that kind of sacrifice. And I became a teacher. And then soon after I became a teacher, Sandy ended up leaving Sloan and became a teacher also. So we were both science teachers. I was teaching middle school. You taught high school, right?
No, middle school, 6th grade science.
Oh, yeah. So there you have it. We both taught 6th grade science. And then, of course, we were both like, oh my God, this is horrible. Like, what are we going to do? We want to go to medical school, right?
Yes, kudos to your teachers because, woo,
That was the hardest job I know I ever had, right? Teaching middle school science. Like, I'll go to medical school 3 times before
exactly.
I have to go back and do that again.
Middle school is rough.
So definitely kudos to our teachers because we need you and the job you do is unforgiving and definitely not recognized enough. But after that, we were both like, okay, well, what are we going to do? And then Sandy was like, well, I think I'm going to apply to PA school. And at this point,
Which is a
physician's assistant. And so basically, I end up going to medical school at some point. And Sandy's in PA school. She's about to finish. I'm now starting medical school. And I just had Max.
Mm-hmm.
And so now I'm talking to Sandy. I'm like, Sandy, you really going to do this PA thing? You know you want to be a doctor, right? It's not because being a PA is not a wonderful profession, but there is a certain level of autonomy and the different interaction in terms of the things that you can do clinically that are a little bit different from being a physician's assistant to being a physician.
Would you agree with that?
I agree wholeheartedly. Sophie knows me well, as you guys can tell, and she knew that my personality was better suited to be a physician. She knew that I would always have that drive of wanting more. So, thank God for having friends like that in your corner that's going to hold you accountable.
For sure. So even though she was almost done,
literally, I think I had one more class left.
And I was like, no, girl, you need to apply to this medical school.
So when you went into medical school, did you know you were going to become an OBGYN or you weren't sure there at that point?
Oh my God. So I definitely was not sure there. Zero clue. I went into medical school thinking I was going to be an ophthalmologist. I was like, yeah, but it doesn't do it for me. And I did my OB rotations. And, even though there's a lot of lack of sleep, what really drew me to the field was 1 minute is quiet, the next minute you're on your I like that. I like the adrenaline rush. There was nothing else that excited me as much, despite everything. Yeah.
And then for those of us that don't really, are all OBGYNs, because you're also in family planning, correct?
Yes.
So are all OBGYNs automatically also family planning, or is that 2 separate things, or it's an add-on? How does that work?
I would say it's an add-on. So when you do residency in whatever field, you do residency, let's say in OBGYN or internal medicine, you're a generalist within that field. However, if you want to specialize, let's say if you want to do just GYN cancers, you go into GYN oncology fellowship. If you want to do infertility, you go into reproductive endocrinology fellowship. I decided while I was a resident that I wanted to learn more about the field of family planning. I found it interesting. I knew that I wanted to do it based on one particular case. I'll circle back around and tell you what really got me interested. So after 4 years of general OBGYN, I applied to become a family planning specialist, and I went to BU for that. So that's an additional time after the residency.
So when we say family planning, what does that mean exactly as a specialty?
So as a specialty, so it's the formal name is complex family planning. And what that encompasses is you're learning how to deal with all aspects of contraception. Some patients that require contraception that are unable to, let's say a patient that's on dialysis and you want to help her prevent pregnancy, you would refer her to a specialist, a complex family planning specialist, because we have additional training to know exactly what type of contraception would be safe in someone that's considered high risk. We also learn about providing abortion services because abortion care is a part of OBGYN. It's encompassed throughout the entire our learning process. But as a family planning provider, you are trained to provide abortion services for up until about 6.5 months, 24 weeks gestation, to provide safe, comprehensive abortion care that includes medical or surgical, depending on the circumstances.
Okay. So does that mean, because you deal with complications, that, for example, somebody like Dr. Sophia as an OBGYN might refer somebody in family
I
planning?
refer to family planning all the time because they have, as she said, they take care of the complicated cases. So if someone has a medical reason why they may need an abortion and it falls out of the scope that I feel comfortable to do it, then yes, I would then refer that person to a family planning specialist. Also, there are certain special cases, for example, what we call a C-section scar ectopic, which is a very dangerous place to have a pregnancy, but I would refer a pregnancy like that to someone like Sandy, who is a family planning specialist, because they handle those kinds of complicated cases. They see them more, they have more experience, more tools in order to handle, major complications.
Are all family planning specialists OBGYNs?
No, it's a loaded question. So OBGYNs are formally trained in family planning, but a general OBGYN is also trained to provide abortion services up to a certain point. However, we do have our family practice practitioners that can also provide abortion services as well. However, they are not trained to go as far as we are. For instance, I can provide abortion services for someone that's up to, like I said, 6.5 months. Most family practice practitioners feel comfortable within just the first trimester, which ends at about 14 weeks gestation.
So in terms of what you said, that there was a defining moment with a particular patient that made you understand your decision about going to family planning, what was that?
So I was a third-year resident. In my residency program, the third year wasn't responsible for all the GYN difficult cases. We had a patient that came in. She was about, I would say, 23 weeks. So 23 weeks gestation, came in seizing. She had severe eclampsia at this point. So eclampsia is a condition in pregnancy where mom develops really severe high blood pressure and worsening blood pressure, and the treatment is delivery. And if the mom continues to become toxic, you can affect your liver enzymes, can affect your vision. Worst case scenario, you develop seizures, which can eventually lead to stroke and organ damage, etc. So we had a patient that came in via ambulance seizing, and the treatment would be delivery. Because she was so medically ill, and induction. So induction is when we give patients medication to go into labor, but that's a long process. It doesn't happen right away. It usually takes several hours, several days. She needed to be delivered immediately. The only way in which she can safely be delivered would be a D&E, dilatation evacuation. So you're dilating the cervix and evacuating the pregnancy from the uterus.
So is that basically abortion?
Yes.
Okay.
But you have to be trained to do so at such an advanced gestational age. At my institution, the only person that knew how to do that procedure was our chair. Our chairman lived in New Jersey. Patient came in the middle of the night seizing. We had to call our chair at 2:00 in the morning in New Jersey to come to Brooklyn to come and perform a D&E. And at that point, I realized I need to learn how to do that, because I want to be the person that's able to provide that care. Because if we didn't have him, we would have to transfer the patient out, but she's unstable to be transferred out, which could have meant the mom's life.
Because she was literally in a critical situation.
Very.
Yes, she was knocking at death's door. Yes.
Wow. Okay.
Yeah. So that was the defining moment for me.
Wow. Thank God, you guys were able to provide that kind of care. And I'm assuming, yes, you saved her life.
Yes, we saved her life. She turned around, her liver enzymes trended downwards, and she stayed in the hospital for a few days. And then she was able to go home with an intact uterus, able to conceive at a later date and time, if so necessary, if she desires. And which is why this, post-Dobbs decision of restricting abortion care is such a critical thing that I need everyone to understand, that it's really important that we vote for people that are going to respect women's rights. because Sophia and I are on the front lines. We see patients that are harmed by this decision.
Absolutely.
So it's really, really important that we get out and vote.
I just want to reel it back for a second and just go down more in terms of the basics. So you explained a little bit what abortion is, but is there one definition of abortion, or in terms of the different ways of having abortion? Like, could you just level set in terms of what we say abortion, what do we mean?
Sure. Yes and yes. So abortion as a catch-all phrase in the medical field, we refer to abortion whether it's a miscarriage or whether it's in what we call an induced abortion. That is a catch-all phrase for us. Any pregnancy interruption in the medical field is considered an abortion. So let's level the playing field there.
So you're basically saying when a woman has a natural miscarriage that is out of her control, that's also considered an abortion.
Yes.
So that's not commonly known, because people think that abortion is something that you decide upon, but it's not the case.
Exactly. That is not the case.
Okay.
So with any interruption of pregnancy.
But before actual delivery time is considered an abortion. When it's a miscarriage, it's known as a spontaneous abortion. And if it's a elective termination, let's say, you're not ready to have a child right now, or in the case of my patient that was seizing, she needed to have an abortion, it's called an induced abortion.
Okay. So it's the difference between spontaneous abortion and induced abortion. Either way, it's abortion. Okay.
Exactly. So that's first. In terms of different ways of doing abortions, you can do what is known as a medical abortion, or you can do a surgical abortion. I have to reel it back a little. So the pregnancies are divided into trimesters. So from time of conception to about 14 weeks gestation is considered your first trimester. During that time, you can have a medical abortion or a surgical abortion. A surgical abortion can be done at any time during the pregnancy. Most medical abortions are done only during the first trimester.
Okay, when you say most, you mean like literally over 75%? Like,
I would say even upwards of 80 to 85%.
And when we say the majority, we're talking about abortion that includes miscarriages as well, or when we're just talking about, okay.
Mm-hmm. And then, so after 14 weeks gestation, the procedure goes from a medical abortion to surgical abortion, or what we call a medical induction. So when we're doing a medical induction, the nuance is that that's usually done on labor and delivery. We're giving the patient medication. It's like inducing a pregnancy. We're inducing the patient on labor and delivery. We're giving them medication to deliver vaginally.
Because it basically like stimulates
the uterus to go into labor.
Got it. Okay.
Yes. But at that point, if the patient, or for whatever medical reason, a surgical abortion is warranted, that's when we do a D&E, a dilatation and evacuation. That's the surgical portion.
So what is the difference between the medical abortion and the surgical abortion?
The major difference is for the medical abortion, you're using medication to elicit interruption
contractions,
of the contractions and a dilation of the cervix to expel the pregnancy.
Mm-hmm.
Versus in surgical abortions, you're dilating the cervix mechanically. You're doing the dilatation with an instrument, and then you're using either an electrical vacuum to evacuate the pregnancy or a manual vacuum, like a big suction syringe. I don't know how else to describe it.
And then depending on the case, depending on the time frame, one of the two is more preferable.
Yes. And also patient preference.
And patient preference.
Mm-hmm.
And is there also, Sandy, a point where there's even a safety issue with one versus the other?
Yes. For example, let's say you've had a patient that's had multiple C-sections and for whatever reason either decides they want to interrupt their pregnancy or needs to interrupt their pregnancy for a medical reason. It's safer to do a surgical interruption as opposed to a medical interruption because of the medication that we use to elicit a medical abortion can be harmful to a uterus that has previously had a surgical scar.
That's important to understand, that sometimes having a surgical termination or abortion is warranted because of the fact that going the medical route may actually do harm or not be able to give you the best chance of keeping what we call an intact uterus. Is that?
Yes.
Yes.
So I think one of the things, and this has really brought to the forefront since 2023, 2024, when we've had all these laws reprimanded from an abortion standpoint. I think one of the things that is a huge misconception is that abortion in certain cases is actually medically necessary and is actually not about choice. And choice is, we're all about choice. But I think that the other part is not really talked about as much.
Mm-hmm. I agree. The problem with all these people commenting on abortion is that they're not actually asking the medical experts, and we're just letting people with opinions dictate what should be done with a woman's body and not really understanding the science behind it, not really understanding the complications. And like I tell my residents, whether you're for abortion or not, everyone should learn how to care for a patient that has had an abortion, that requires an abortion, and everyone should know the basics. Because you never know when you'll be faced with a patient. You could have a patient that had an abortion elsewhere and comes to you hemorrhaging. You still need to know about abortions in order to care for that patient, because the complications, if you're not aware and you're not heightened, the patient can die from bleeding, from et cetera. So I think it's really important, where I think the medical community needs to do a better job of educating everyone about what exactly abortion is and what it's not, and just getting the basic knowledge out there, because there's a lot of misconception about the process of abortion, whether or not fetuses can feel pain, whether or not the fetuses are delivered alive, et cetera. All of these are misconceptions and myths and not actual scientific fact. And it's my job as an abortion advocate to promote and let everyone know that abortion care is women's care.
Amen. Say it loud, say it louder, say it proudly. It's a part of taking care of women.
It is.
It's like other organs that we have in our body, like our heart.
Exactly.
And our liver and our uterus is part of organs we have.
Yeah, it baffles me. Every time I have these conversations, I'm really, truly amazed at how people have such strong opinions about abortion care. I remember a story where, as you guys know, I provide abortions. I'm proud. I have no shame in providing abortion services. I was pregnant, and a nurse asked me, "How do you feel about providing abortion, being pregnant?" I said, "How do you feel about providing diabetes care for a patient that comes in and hasn't been taking the insulin and requires an amputation? Don't you still provide the care?" My job is to provide care, not to judge. And that's just how I approach it. I'm here to provide a service and to acknowledge my patients, not to judge. That I have no opinion one way or the other. I'm here to provide a service. I can provide the service. I do it well, and I will continue to do it.
That's such an important difference, because everything else is coming really from a science-based, health-based lens.
Yes.
Versus abortion, it comes from a judgment lens first.
It does.
Meanwhile, it's all just different organs in our bodies. It's the same thing.
Yeah, like I really want to know, why are people so polarized by abortion?
And they are. They really are. And for me, it's just the mere fact there is nothing about a man's body that anyone in any way, shape, or form has any control over. We don't think that a man has no agency over his body. And we know that men are the least likely to go visit a doctor, to take care of their health. If a man does better, who is married or has a woman in his life, will actually be healthier, because that woman will take care of her whole family. She makes sure that everybody in her family gets health care. And so she's actually advocating for a healthier man. And yet in society, men think, or people in general who are advocates for the fact that women cannot make decisions or have agency over their own bodies, like you said, Sandy, is baffling.
I mean, I think it was the key word that you said is control.
Yeah.
At the end of the day, it's about control. It's about they don't want us to have full control, to have full agency. And that's been historically there. And that is sort of like the last frontier where they still want to control us biologically.
It's sad. And when I look at the statistics and the statistics that the politicians are spewing in terms of it's mostly unwed women, uneducated women that are coming for abortions, that's actually furthest from the truth.
Tell it. I knew she was going to come with this.
If you look at the numbers, the majority of people that are getting abortions are women that are actually in relationships. It's their second or third child, and they just feel it's not the right time. So this myth about it being uneducated, unaware, or women that are just trying to that have no desire, no control, no education is false. It is so false, and it angers me. And as you can tell, I'm very passionate about this because I just cannot understand why. I just do not get it. And again, what like I had to say, I'm so happy. I'm so excited for Kamala because I know that she's going to fight for us, make sure that women's rights is on the forefront. And hopefully we can turn this thing around that the Supreme Court has just shot down with a stroke of a pen.
You're 100% correct. I mean, we need to be on equal level playing field. If a man has full agency over his body, there is nothing that the government is controlling when it comes to a man's body, then there is absolutely nothing that should be controlled in terms of a woman's body. We are human beings, and there should be zero control regardless of what our gender is, our gender identification is, etc. We should be able to have control of ourselves.
Mm-hmm.
We should.
I would say also, I mean, I'm a relentless optimist. Even when bad things happen, I try to figure out, okay, well, what does this mean? Of all the atrocities in terms of what has happened on this issue for the past year and a half, the silver lining about this is that we're actually talking about this. And I think that even if we didn't have this before, there was always a ridiculous stigma and judgment against women who had abortion or were considering abortions. And now we can actually talk about it openly and actually say, no, this is part of who we are. And so I always try to say, okay, so what is the flip side of this? And how can we use this to actually empower us and empower culture in terms of evolving our thinking? And so when it comes to stigma, do you feel that it has evolved over the time that you've been in this position of helping women go through this? Or do you feel it's remained the same? Or how have women dealt with the whole sort of psychological aspects of abortion?
That's a very good question. And I think that it's a moving target. At times, I feel that we are progressing ahead in terms of the stigma that's surrounding the word abortion. At times, people wouldn't even use the word, though. We have euphemisms, termination, interruption, pregnancy interruption, et cetera. Even myself, you see how I started it, because there is a stigma around the word abortion. However, post-Dobbs, I have seen more people actually coming and admitting, well, I had an abortion when I was in college, or I had an abortion for this, et cetera. So I feel that Dobbs has actually, like you said, made it more, has humanized the element of abortion, has allowed more women to come forward and explain their story about why they had to do it. And I want everyone to understand, having an abortion, whether you wanted to or whether it was medically indicated, is the hardest decision a woman will ever have to make. And I want to reiterate, it is not easy for a woman to say, I think this is not the right time, and I'm going to proceed with, an abortion. And because the way abortion is stigmatized, it makes people feel as if the people that are doing are flippant or callous. And that is not the case. These women are torn apart, are crying literally right before we put them to sleep, before we do the procedure. They are crying hysterically because they feel the guilt. They feel the stigma of people judging them. So I just want people to understand that the women that are making these decisions, it's really gut-wrenching. And if you've never been in that position, I really implore you to have some empathy, because it's really hard. Doing this work every day, I see it from all aspects. And I just want people to have empathy.
When you say like women are feeling guilt or feeling judgment, I think there's that level, but also their own sentiments of what they're going through in terms of their decision, like regardless of the people around. It's like a double weighted emotional load. Do you feel that it's that almost the external judgment has a greater weight than their own, or it depends?
I feel that the external judgment makes its way into their own internal psyche, and then they incorporate that, and it heightens their own internal conflict. Because I've had patients ask me, do you think I'm going to be punished? Or a lot of women that are religious that choose to abort feel that will God allow them to have children in the future if they do this? Again, I just wish we had medical people that could actually stand up to the politicians and really educate the public about what an abortion is and not, and the weight of having an abortion. And sometimes it's the best option. It's sometimes it's really, truly the best option. And you shouldn't feel guilty for doing what's best for you. You should not feel guilty for that.
So from my experience, I just want to talk about one thing. And that is as an authoritative figure. So as a physician and in my relationship with a patient, in that role, I like to really, as much as I possibly can, destigmatize the choice that they're making and the guilt that they may be, that internal conflict. And I do so just by asking them sometimes some simple questions. How would this affect your life right now if you had a pregnancy and went through with the pregnancy? If this is not the right time, that is okay, because we make decisions about things that are not the right time for us in so many different aspects of our lives, whether that's getting married, whether that's going to school, whether that's the type of job that you take, and that this is no different. When you make a decision to have an abortion, it's because you're making a decision for your future self. And that a decision like that, for sure, is never taken lightly, but that to feel secure in your decision. So that way you don't have to live in this constant level of guilt, of shame that is associated with abortion because you chose yourself.
Exactly.
I think I love that. Also, it's a very feminist perspective, which is what we want to be.
Yes.
Unfortunately, a lot of women, when you say, you come first, unfortunately in this society, we have not been brought up that way. And I
don't think of it as being feminist. I really don't. I think of it as being self, which is everybody.
Feminist just means that you're basically putting yourself first as a person.
But not just as a person.
Yeah.
This is my point.
Yeah.
Right? And so to me, I think even making it the word feminist and calling it woman and feminine, I think is where the confusion sometimes comes in. I'm not saying that that's not in fact the case. It's just that it's more so to really dig down and have women understand that you're making a decision that is going to be best for you, and that you should not feel guilty in making that decision. And I think when it comes from a provider that gives them that level of support, that opportunity to say it is okay, right? I do think that allows them to renegotiate in their minds that level of guilt or that level of shame. And that is the part, I think, as medical providers, as you say, Sandy, that we really need to do a better job of promoting in society and promoting that kind of narrative that you doing the best thing for yourself is definitely okay.
I 100% agree. And I also totally agree with the level of authority that you have and bringing that level of understanding to your patients, to women. I'm just saying that a lot of women have not put themselves first in their lives because they're brainwashed that they should put others first.
Yeah. I agree.
And so that thinking is very difficult to
undo.
correct.
I agree.
Especially with a huge decision like this that also has all this judgment around. So how can somebody help them like move through that, I guess?
Well, it's with the support. I think that's the whole point, is to even bring it to the forefront, having that conversation up front, and saying that it's okay for you to choose yourself, because that's not what they're thinking. And I think that just by saying it allows them to now start to conceptualize it in a different way. I'm not saying that it always works, but at least it allows them to have the thought process, and like I said, it's where judgment comes from the fact that you think that somebody else has a more of authority over yourself, and so if we're able to take away that sense of judgment because other people, society, what have you, has that control over you, and you start to reinvigorate or reimagine the self-control and bring that back and put that back into their hands, then now let the judgment be between you and whatever, your God is, if that's who you feel is judging you, and let that be a conversation that you have that way. But otherwise, if it's just from a societal standpoint, I like to really remind women to think about it as the most important person to them should be them. And we move from there.
I 100% agree.
So I 100% agree too. I'm just even saying me as a woman. I'm 52. And even if I was brought up to be independent, it took me a long time to decode stuff that I didn't even know was what area that I was brainwashed. So it's a process, like even if also that, it should be my decision and that's the way it should be, it's these programs that are defaults in our brain. It's just difficult to deprogram. So I do agree with you, like for both of you, for being physicians and allowing that person to say, no, you actually matter. Coming from both of you is very important because you're giving them more agency as a person that they entrust. So that's even more important. Would you add anything to that, Sandy, in terms of how you approach your patients?
Yeah, definitely. Like Sophia, I always tell them that they're making the right decision for themselves at that time. And I usually tell them that how life is about changes, life is about acceptance, and life is about realizing that, what might be right today, you might have a different view tomorrow, and that's okay.
Yes.
Because I have patients that come a lot that said, I never thought that, and I was like, and that's okay. You're here now, and it's okay. And giving them, I think just telling them that it's okay and that life is dynamic and things change. And I feel like that has really helped a lot of my patients, a lot of patients, especially the ones that were once judgmental. I have one patient in particular that was a devout Catholic, did not believe in abortion until her daughter needed an abortion. And then she apologized and said that she couldn't believe that she was once this way, etc. And I told her, it's okay. You were, it didn't affect you directly. And so you really didn't have a sense of what goes on. And now that you're here, I'm just happy that you're aware and you're okay. And you've come around and it's fine. And so I tell people all the time, I'm okay with you having one view, but then after we have a intellectual discourse, you can see my view and you can accept my view. I'm not trying to change your mind, but I want you to accept whatever my decision is and don't judge me for it. And I think that's what people need to realize. We're not here to try to change anyone's mind. We're not here to try to change your religious view, your moral beliefs, etc. I just want you to accept whatever my decision is and be okay. And then I don't feel judged by it. And we can coexist. We don't have to agree. Just be willing to accept and learn. And I think that's my message for today. Acceptance and learning.
You're absolutely right. Because at the end of the day, no one is forcing abortion down anybody's throat. It's an individual and personal decision.
It is.
Right. And so if it's not for you, that is also fully okay. And we fully support that. And hey, I'm still delivering babies. So,
Exactly. That's how I make my living.
And super happy to do it. But at the same time, if I have a patient who comes in and decides that an abortion is what they need, I'm also equally supportive and happy to provide a service that I can provide, And I'm with you there. I'm totally with you there, Sandy.
What's really interesting with this conversation, it's not just it's so dense. It's so like in terms of physiologically, then you have politics, then you have psychologically, like it's such an intricate, that I'm sure you have very interesting conversations, Sandy, in your office
Every day.
every day. And then Sophia too, like, yeah. In terms of where we're moving forward towards, like, Kamala all the way, obviously, but what is there anything that you would recommend people to be aware of as we're entering in a more hopeful phase, just in terms of politics, but also just in terms of what we talk about in terms of women's
Like
rights when it comes to their bodies
and how do we do
advocacy?
this?
Yes, I will say that my number one thing, I want people to realize that not that the presidential election doesn't matter, but our local elections matter more, because those are the people that are going to be your activists, your lobbyists that are going to go to Washington to try to get different laws that are passed. New York, I know, is trying to codify abortion, so New York can always be a place where abortion services will be provided. And the only way that that can happen is if we vote in our local elections, vote for the local people that are support of women's rights, that are support of abortion. Because if not, by the time it gets to the presidential election, it's too late.
As we have seen.
Yes.
With Dobbs.
With everything.
Yes, agreed.
So it's really, really important that people get out and just vote locally and listen and hold your politicians, hold their feet to the fire. What are you doing for women's rights? Why is women's rights important to you? And let them know that women's rights is everyone's rights, because women, we're the backbone of society. We're the moms, the sisters, the daughters. They need us. And we have to start making them realize that they need us. And we need to be able, in order for us to be a fully functioning, self-sufficient woman, we have to be able to have agency over our body, whether that be we decide to have 10 children or we decide that we don't want any. That's our right, and we shouldn't have anyone interfere with that.
Tell it, sister.
All the way. Yes.
Right?
Yes.
Tell it. No one is supposed to interfere.
No one.
That is your choice. My choice. Touseef's choice.
My choice.
Yes, my choice, and continues to be my choice. And I have a son. Sophie has sons, and I know that we're raising our sons to teach them that it's a woman's right.
Mm-hmm.
It's a woman's right.
Amen. They know it.
That
There's
too.
no
That's
question.
another way. That's another way to be involved, is to start right away with the younger generation.
Yes.
So they know this way of thinking and understanding.
Definitely. I think Gen Z is the way. I think they're motivated. They're woke, as we like to say. They understand the issues at hand, and I feel, like you said, I feel optimistic. I feel that this is going to be it. Kamala's going to take us home, and we're going to figure this out.
Go Kamala.
Go Kamala. So I think in closing, Sandy, if it's possible, just give us your final thoughts on how women can truly embrace themselves with the concept of abortion care.
I think it's important that when a woman seeks a GYN, that they ask the hard questions. They ask, you're going to be providing my GYN services. How do you feel about, do you provide abortion services? And if you don't, do you have somewhere I can go speak to, open up the dialogue? Because again, like we said earlier in our talk, abortion has been so stigmatized that a lot of people don't even bring it up until they need it. And then at that time, they find themselves scrambling, oftentimes where they didn't realize their provider doesn't provide those services, or doesn't know anyone, doesn't know where to send them to. Oftentimes, we're getting referrals from all across, but even though we're in New York, we're getting referrals from all across New York, because abortion is not on everyone's forefront. It's not a thing that a lot of people do, or a lot of people don't want to admit that they do it. So I just feel that if patients are bringing it up more and more, it's going to force the conversation and it's going to become something of a topic. And then more people are going to feel comfortable, even though they don't necessarily provide the services, they'll be more willing to say, well, you know what, this is my colleague. She provides these services. You can go to her if you ever need them. And so what I say is just talk about it. You have to talk about it. Don't be afraid to admit that you provide abortion services. Don't be afraid to talk about it. Because a lot of providers won't say that they provide abortion services. I tell people all the time, yes, I'm a family planning specialist. I do abortions. It's like I'm a diabetes specialist. I treat patients with diabetes. It's the same thing. You got to make it common day language.
Because abortion care is health care.
And that's that.
And that's that.
Thank you so much, Sandy. This was an amazing conversation. I'm so happy we had it.
Oh my God. Thank you guys for having me. I really enjoyed it. And I'm willing to come back anytime.
Oh,
Okay.
yay!
Then you will.
All right, Sandy, thank you, Dr. Sandy Dorcelus, for joining us here on the Dr. Sophia ObGyn podcast. It was wonderful to have you, and have a great rest of your day.
You too. Thank you, guys. Bye.
Bye. This is general medical information based on my professional opinion and experience. For specific medical advice, please refer to your physician. Until next time, embrace your body, embrace yourself.